So first, I would like to ask for your both permission to use this video for educational purposes.
Yes, that's fine.
Okay. Now, why don't you tell me a little about your symptoms before the surgery?
I had pain down the legs and my legs would go numb.
How bad was the pain?
It was really bad. Some days I wouldn't be able to go to school.
And you know, one on the scale 1 to 10. What?
It was a 10.
It was a 10. How long have you had that? Did you have that pain?
A couple of years.
A couple of years. What happened in those years? What did you do to help with the pain?
Rested, stayed in bed.
Physical therapy, injections?
Yep.
And you saw a few doctors before you saw me. Tell me about your experience there.
It wasn't real great. She had a lot of doctors who said she was making it up. It must be in her head because she was too young to have back issues.
I like to see that you say that too young, because this is what this video is about that even young people can have real problems. Now, when you saw me, we saw each other last year, and then we I think we did a discogram. Did we do as well? Did I as well send you for some more physical therapy and injections?
Yes.
Yep.
So we still tried another set of conservative therapy, and after that failed, we did a discogram. And I'm just going to describe the discogram that we did a level that we thought is a problem, the pathologic level, and we did a control level, a normal level, and the normal level was negative, and the control level was negative. And your level that we had in question provoked the pain, so we decided to do the surgery. When was the surgery done?
December 17th, 2015.
Okay, and we did a minimal invasive OLLIF procedure. How long did you stay in the hospital?
Overnight.
Just over the night.
Yep.
And just next morning after the surgery, we sent you out. How were you doing after the surgery and right after?
In a lot of pain.
As expected.
Yep. But the pain down her legs was gone.
Immediately.
As soon as she came to in recovery, she said that pain is gone.
And this is a proof that it's not in your head. It wasn't in your head. It was never in your head. Now, obviously, there will be a healing time. And tell me about your daily life right now, and how you have been doing, and how has pain been in the last few months?
Pain has been getting a lot better. It's just recovery.
More muscle pain is what she describes it as things are healing.
And you just described to me certain activity provoke the pain. Just tell me about that.
Like certain strides
Excellent.
just cause muscle pain.
Yeah, and pain is a protective mechanism in our body to tell us how for us to protect the body. And I think we are on a good path now. The surgery has been almost about 8-9 months. And we talked about that fusion process can take a year or sometimes even more, and we are going to just go back and look at the films together. And I'm going to just swing here where we see where we did the minimal invasive fusion. In your here I'm going to count with you 5, 4, 3, 2, and the screws are in a good place, the cage is in a good place as you see here. We still have a little bit of healing to go, because I see that the connection is not completed, but this is as I expect. Usually a fusion happens in about a year, but hardware is in place, the screws are not loosening, and if we go back as well, we see the rods that connect the screws together. And I think this is what we expect. You still have to be careful. There are still certain activity that will increase the pain, but we will have regular follow-ups, and we go from there. Okay?
All right.
Any question?
No.
No? Okay.